I'm very happy to be talking about this topic today with everyone in attendance here today. And I want to thank Spark for inviting me to present this webinar, A Parent's Guide to Nurturing Social and Communication Skills in Young Children with Autism. So my main goal today is to give parents practical, everyday activities that they can do with their children. So while various professionals and therapists and educators can and do contribute to a child's growth, parents and caregivers are essential as intervention agents for their children with autism. So this talk is for parents and for caregivers of young children who might already have a diagnosis, but it's also for parents who might be in the evaluation process already, or for those who are waiting. If you're a parent who's concerned about your child's development for any reason, or perhaps you haven't even started the evaluation process yet, perhaps your child is at risk for autism or a developmental delay, this webinar is for you. In any case, I hope to empower parents to begin now, using everyday activities to nurture social and communication skills. Okay, so let's review the rest of our agenda for our time together today. I'm going to begin by reviewing what it means for a child to be at risk for a developmental delay or autism and tools for early screening of your child's development. The bulk of our time together today will focus on parent-led interventions. I'm going to cover 7 critical domains or skill sets, and these are activities that you can incorporate into your daily routines to promote social and communication skills. These activities are part of Alpine Learning Group's evidence-based curriculum for young children, and we use these activities in our parent training program. I will end with some general helpful tips, and as Dominique mentioned, there will be time for questions at the end as well. Okay, so let's begin. Oh, before I begin, I do have to make this quick statement on videos. This presentation does contain videos of parents and children, and consent was provided solely for the use of videos within this webinar. Please do not use your personal devices to record or take pictures of the children shown in this webinar, and please do not edit or repost the videos to social media. All right, so let's start with talking about what it means to be at risk. So a child is considered to be at risk if they have a sibling with autism or developmental delay, or there is some familial history of autism or developmental disabilities. Perhaps there was a premature birth or low birth weight, a difficult pregnancy and or delivery, some medical condition that might influence development, an unknown history. So perhaps if a child was adopted and the history of the child is unknown, perhaps there was a lack of developmental stimulation early on, or again, some unknown history about what happened early on in the child's development, pre and postnatal, perhaps exposure to toxins, or that the child is showing some type of concerning behaviors or delays. So what should you do if you're not sure if your child is at risk or if they're showing delays or not? There are a number of screenings that you can do as parents right at home. The first one is for general development, okay, overall development. And many of you may know this already and may be familiar with the Center for Disease Control and Prevention, the CDC. They actually have a milestone tracker. It's a downloadable app as well. You can track and follow your child's development in the first 5 years of life. It's also nice here that it gives suggestions for activities to do with your child and ways that you can interact with your child to help promote development. Now you can scan the QR code here, or you can just Google CDC's free developmental milestone tracker. I'm not going to be discussing milestones today. It's beyond the scope of this presentation, but please use this as a resource. It's an excellent one. Another quick resource for a quick screening of your child is called 16 by 16. And after you register with the Baby Navigator Autism Navigator, you can do a social and communication screening with your baby. So the QR code is here as well. And here's a little more information about that. Here's the actual list of the 16 signs for autism included in this navigator. So if these are the 16 signs you want to look for by 16 months. That's why it's called 16 by 16. Now, if you look at items 1 through 9, hard to get your baby to look at you, rarely share enjoyment with you, rarely share their interests with you, rarely respond their name or other bids, limited use of gestures such as show and point, hard to look at you and use a gesture and sounds, little or no imitating other people or pretending, using your hand as a tool, and more interested in objects than people. These first 9 are the ones I'm going to be targeting in this talk today, and I'll be speaking to in this talk today. The activities that we have here today will address these first 9. These are all related to social and communication. Now, again, if you're specifically concerned about autism, there's something very well known called the MCHAT, the Modified Checklist for Autism in Toddlers. And it's something quick that you can do online. The outcome includes the risk level for autism. So that lets you know whether you should pursue an evaluation and speak with your pediatrician. I just wanted to note here that most pediatricians do this by the age of 24 months. But if you are concerned about autism specifically, you can just go online, do it yourself as early as 16 months. Okay. And then you'll have that information to bring to your pediatrician and have a structured way to talk with your pediatrician about your concerns. Okay, so let's get to the bulk of our talk today. You've identified some issues or concerns possibly. Maybe you've reached out to begin the evaluation process, to obtain services for your child, or perhaps your child's already in intervention. What are some parent-led interventions that you can do while you're waiting for services, or that you can do to supplement the services your child is already receiving? So we're going to get now into those 7 critical domains or skill areas. And the first one might be surprising, and it's something you might know about already, but I'm going to talk a little bit about tummy time. This is now if your child is very young, starting around 8 or 9 months, not yet crawling, maybe even earlier. You might know of tummy time as an important way to promote physical development, but there are various ways to promote tummy time that contribute to social development, right? So you can prop your baby up on a pillow to get them, or place toys in front of them to get them, interested to raise their head and their upper body and their neck. However, it's a great way to promote social development by placing your baby on your chest. And this way you are face to face with your baby. So opposed to your baby being on a floor or on the pillow, and you can really adjust the angle by putting a pillow under your upper body, whatever it is that your baby needs. This way you're face to face, and you can experiment with different facial expressions and sounds, and you can talk to your baby, and that encourages your baby also to lift their head and their upper body. But it can also establish that social interaction. And even possibly that social interaction can work as a reward for them lifting themselves up. So that's a great activity to do really early on. The next area is social looking. And so one of the most important lessons for your developing child to learn is that interacting with other people is meaningful. And that's because most of learning and development occurs within a social context. So therefore, it's going to be important that a child shows interest in adults and in their caregivers early on by orienting towards them, by looking at them. And we often term this social looking. It's different than looking at objects or events in the environment, but that's also important. So specifically, social looking includes making eye contact, joint attention, and social referencing, or simply looking at caregivers' faces, or just turning in the direction of caregivers. So what can you do to promote social learning? One of the easiest ways to promote social looking and the most familiar one, is playing peekaboo. And this game is about looking for the adult, looking for another person. And here in this picture, you actually see a combination of tummy time and peekaboo. One of the important things, anytime you're doing these kinds of activities with your baby or your young child, and you're going to see this theme uh, consistently throughout this presentation, is pausing and waiting. And, starting the activity and then pausing and waiting. And that gives your child the opportunity to respond themselves, right? All right, so let's look at a video of a mom and baby playing peekaboo. Very familiar to all of us. Now notice the second time mom does it, there's a small pause after she says, "Where's mommy?" And really what she's doing there, she's waiting for the baby to show interest by looking in her direction. Okay, so let me play that.
Ready? Where's mommy? Peekaboo! Where's mommy? Oh, peekaboo!
Okay, so there you saw that baby was looking away and mom waited for the baby to turn back in her direction before she continued with the activity.
Ready?
Okay. The next activity to promote social looking is called looks to resume activities. So now this is kind of taking that concept and generalizing it to other activities you might do with your baby. So this can include visual, auditory, or tactile components, swinging and singing, tickling, making noises. The parent can repeat this a few times and then pause. You're going to wait. See what the baby does. If the baby looks in your direction, then you resume the activity. Now, if the baby doesn't look, the parent might have to make some additional noises or even move into the baby's line of sight before resuming the activity. Now, let's take a look at a video of what this looks like. Here, mom is playing a physical game with the baby. She's rocking the baby, making noises, and kind of repeating the same pattern before pausing and waiting for the baby to look. Okay, let's see what this looks like.
Do it again. Let's do it again.
All right, there's that same kind of pause, right? So think about all the different activities that you might be able to do where you can incorporate this kind of pause, right? To get your child to look at you, to resume it, right? So that teaches the child that looking at other people is important and it allows them access to things that they enjoy.
Do it again.
Now you can apply this same type of strategy during feeding. Feeding is another great time to work on having your child look towards you or look in your direction. Feeding is not a passive activity. You can make it a very uh, a social learning experience, right? So it's the same sequence as we discussed for the last activity. You would begin feeding your child, make sure they have a few spoonfuls of food to begin with. You compare some words or sounds here like yum yum, or maybe you might sing a special song to your child while they're eating. Then at some point, you'll pause the spoon near your child's face, wait for them to look up at you, and then place the spoon in their mouth. Now, if they don't look at you, you can do something that we call a swipe, where you might swipe the spoon close to the baby's face and raise it towards your face so that they can track it and then, follow it up to your face. Now, one of the prerequisites to all of these activities that I just shared in this category is that we want the child to be able to orient towards sounds and voices. If your child is not doing that, it'll be important to have a hearing evaluation to just make sure that their hearing is okay. All right, so we always want to have their hearing checked. Okay, so now let's see the same mom and baby pair during feeding, demonstrating teaching social looking here and that spoon swipe. And you can really have fun with this. You can use all kinds of sounds and songs and motions with the spoon. Think about the old, choo-choo train example. Okay.
Okay. Whoa, isn't that oatmeal good? Yummy.
Great.
Okay.
Okay, another foundational skill, our next skill domain, is what we call reciprocity or social back and forth or social turn taking. Now, if you think about it, most social interactions involve turn taking. I do something, and then you do something, and then I do something, and so on. And so the reciprocal nature of a social interaction is something babies learn very early on in development, and it's something that can be promoted and nurtured and taught. And so this reciprocity can be both verbal and nonverbal. So the first activity is a nonverbal activity, and it's just simply handing items back and forth with your child. So, for example, shaking a maraca, hand it to your child to shake. Put your hand out to encourage giving it back. You can use some gentle guidance here if you need to as well. Then you shake the maraca and then repeat, right? So you'll see this kind of repeated theme here throughout of our talk together today is that pausing, giving your baby a chance to respond, and repeating things over and over again to give your baby and your young child the opportunity to learn and predict what's going to happen. All right, let's see a video sample of how we can promote nonverbal reciprocity. So note here how the mommy is using some gentle prompts to get her baby to give the toy back. Now, again, you might need to use some gentle guidance with your baby or your young child at first.
Hannah's turn.
Good.
Good
Put your
job.
hand-
Mommy's turn. Look, mommy's turn. Thank you. Shake, 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 shake. Hannah's turn. Go ahead, shake, shake, shake. Mommy's turn. Look, mommy's turn. Thank you. Shake, shake, shake.
Okay, wonderful. All right, the next activity in this category is taking turns with a completion task. This is also a nonverbal task. Although mom in that last video was talking with her child, absolutely. The response we're requiring from the child is nonverbal, right? So in the last example was handing back and forth. Now this one is going to be something similar. So taking turns putting items in a bucket or placing rings on a stacker or putting pieces into a puzzle. So there's all types of activities that you can choose for this. So for example, you might place a ring on a stacker, hand the stacker to the baby. They place the ring on the stacker. They hand it back to you, and so on and so forth, right? So taking turns with completion tasks. And of course, you repeat that over and over again. And that's another way for them to learn this social back and forth or social turn taking. The next is a verbal activity. And so we're going to shift to promoting some verbal reciprocity. And this first task is imitation of your child's vocalizations. And so your child might vocalize or babble in some way. And then what you're going to do is imitate what your child just said to you. So whatever sound they made or word they said, you might imitate that back. It could be an approximation of a word. Now, if your child has limited vocalizations, one important tip that can help is to use movement. So if you think about speaking or vocalizing or babbling, that's actual movement, right? And so you can encourage vocalizations by moving your child, regardless of their age. As long as we're sticking in this young, infant, toddler, preschooler category, bouncing, lifting your child, playing tag or running around with your child, tickling, roughhousing. You can encourage sounds and words in this way, and you'll see this in the next video. Again, we're going to use that same strategy here, the pausing, giving the baby a chance to make sounds, movement to encourage vocalizations, and then you'll see mom imitating baby. And you'll see this little back and forth between mom and baby here.
Abba. Ba, 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 ba. Yeah, Baba. Abba, abba.
The next activity to promote verbal reciprocity is fill-ins with songs and books. So this can be done with singing familiar songs with actions with your child, like Itsy Bitsy Spider or Wheels on the Bus, or maybe some song that you made up and use consistently with your child while they're bathing or while they're getting dressed, or um, any other activity that you do during the day. So if you're using it consistently and regularly enough, oftentimes if you pause and wait at a particular time in the song, that gives the child the opportunity to then either say the word or fill it in or even make a sound or babble, right? And then once they do, then you resume the song and then you pause again. And again, here we are teaching that back and forth. So you see how the pausing is very, very important strategy. Now you can also do this with those repetitive books like Brown Bear, Brown Bear. And those books are that way for a reason, right? And we see that repetition really promotes learning. But we can build in some opportunities for teaching this back and forth by, pausing while reading those books, so the child can, anticipate, what's going to happen next and vocalize, gives them the chance to vocalize. All right, let's move on to our next foundational skill, communication with gestures. Now, communication is more than just talking. It occurs non-verbally in children before children can talk. So a child might point to things in the environment to gain access to it, to share interest with you as if to say, hey, look at that, to obtain information, as if to ask, what is that? A child might pull or push you towards something to gain access as well. Children show things to others by holding up objects for someone else to see. And they also give or hand items to others as a way to ask for help for something, for example, opening a container. Now, the first activity to promote using gestures to communicate is to promote accessing help. And what you might do is place a snack in a container, one that they can't open. So you might shake it to get their interest or hand it to them. And you're going to wait now. You're not going to help right away. And then what you'll do is give them the opportunity to try to open it. And then you'll gently guide them to hand it to you to get you to open it. And then you can provide some praise, of course, and some positive language. And then, of course, you'll open it and provide them access to the snack. Okay. Now, you can also do this with toys or objects by turning a toy off that perhaps your child doesn't know how to turn back on, or placing something up high or out of reach, right? In those situations, you can teach your child to gesture towards what they want or hand you the toy that they want to help turning back on. Okay, let's look at a video. The mom hands her child a container she knows that he can't open. She waits for him to hand it to her before opening it. Now here he didn't need guidance, and maybe on some prior opportunities, she had to help him a little bit, but this one shows him actually that he's mastered that skill here.
Oh, you want to open? Sure, I can help you. Here you go.
Thank you.
You're welcome.
Great. So mom was really patient here. That's really hard to do, right? We want to jump in, we want to help them. But that simple, communicative gesture of just handing the item to mom is that's evidence that your child is learning to communicate, right? That's a great way to promote that. Okay, the next activity here, important in development of gestures, is pointing, right? So here we might use interesting objects or events to promote pointing. So blowing bubbles or activating an animated toy. Gently bring your child over to the toy or the bubbles, and you can gently just position their finger in the point posture, and gently provide them some help with touching the object with their finger. And there you can praise and provide some positive language, and then engage socially with your child and with the actual object. So here, not just handing them the object, that's okay too, but really making a social interaction out of it. Other ways to promote pointing or to model it, model pointing often, pointing at things. You can provide a choice of two things to your child during meals or playtime, and then teach them with that same strategy, that gentle guidance to point to what they want and then provide access to it. Okay, we're going to move on to imitation. And imitation is an essential skill for learning just about everything, including language and social skills and how to complete tasks and how to interact with others. Now, you can teach your child to imitate your actions with objects, for example, banging a hammer, and to imitate your physical movements, for example, clapping your hands or stomping your feet. And those are good places to start. Okay, so the first activity would be imitation with objects. So you would set up two identical objects, sit face to face or across from each other, and you can do this at a table with your child, or if your child is in a high chair or booster seat, you can do it on the floor while you're playing. And you can start by modeling some simple actions. For example, placing a cup on top of another cup or tapping two blocks together. You'll wait a few seconds to see what your child does. You might want to present the model a few times. And sometimes it's helpful to provide, a verbal or some type of auditory sound along with the model. Then you'll gently guide your child to do the same thing that you did and offer encouragement and praise them and smile when they do it. Now, be sure to vary your responses when you're doing this. Don't jump the gun. Give the child an opportunity to respond. And in the beginning, you might want to prompt right away, but then over time, you might want to give your child the opportunity to respond on their own. If you see they're not responding, absolutely go in and provide that gentle guidance. Okay, here's an example. This is imitation with objects. Notice here how mom has to use some gentle guidance to help her child imitate. She also does the, pairing that consistent verbal marker with the action she's modeling. So you'll see.
Tap, tap, tap. Tap, tap, tap. Good job.
So he showed interest, definitely. And this might be a situation where maybe he had the skill. Mom wanted to jump in, make sure he got it. Maybe on the next opportunity, a good idea for her would be to pause and give him a little chance to respond. Okay. Now, the same sequence that we just reviewed with objects, you can do with actions. So you can, sit across from your child or, be close to your child. And you're going to model a simple action like clapping your hands or touching your toes or marching or spinning around. Again, you can come in and prompt right away if this is new for your child, or you can wait, give your child an opportunity to see what they do. You might want to present the model a few times, again, if you're doing this in the beginning, just starting out with this. And then gently guide your child to do the same thing that you did and offer encouragement. Again, same thing. Try to vary what you're doing. Don't always do the same things. And once your child can begin to imitate a variety of actions that are new, that you've never presented for before and you never helped them with before, you can be sure that they're developing a pretty solid imitative repertoire. All right, I'm going to move on to the next content area, which is understanding language. Let's make a little bit of a shift. Now, something we also call receptive language, and we also call it listener behavior. Children understand or respond to language well before they can even speak. And so understanding language isn't a passive skill. It's rather fairly active. The child has to attend to others in the environment. And they have to respond to what other people are saying accordingly. So example includes finding or selecting a response, finding or selecting items in response to what the speaker said, right? So get your shoes or touch your belly or where's your nose, right? Following instructions like come here or sit down. So skills like matching and sorting, putting all the red toys together, putting all the green toys together, that's also a sign of understanding language as well. So here's the first activity that you can do to promote this with your child. So again, sitting face to face or across from your child. This can be on the floor while you're playing or, during a mealtime or in the bath. Um, you might ask a question like, where's your belly? Or you might sing a familiar song with body parts. You'll wait a few seconds to see what your child does and then gently guide your child to touch that body part. So if you're doing this in a song, maybe you might pause right after you say the name of the body part, like head, shoulders, knees, and toes. So maybe you might pause at shoulders or at knees, right? And see what your child does. Will they touch that body part or show you that body part? And if not, you can go in and gently guide them and praise. So here's an example of a mom who's actively teaching her child to respond to these instructions of pointing to body parts. And she's coming in and prompting as she's saying the instruction to really help the child make that association between the two. And then over time, she'll pause and give the child an opportunity to respond. You'll notice that after she does a full prompt, that she gives the child the opportunity to do it on his own right after. So that's a really nice strategy as well. Let's take a look.
Carson, point to your elbow. Point to your elbow. Good job. Carson, point to your belly. Point to your belly. Good job. Carson.
Activity 2 is really just a list of additional ways that you can promote understanding of language throughout the day. So label what your child is doing, label what you're doing, label things around you in daily activities. So if you're taking a bath, you can label the bath toys, reading to your child, labeling something, waiting a few seconds and maybe giving your child a chance to respond and see if they pick it up, right? If they can actually imitate what you said or follow what you said really is the most important thing in this category. Again, understanding language, but you might get some imitation, you might get some vocalizations here too. So that's great as well. So, if they're not responding to your language and the language was directive in some way, like getting shoes, you can just gently guide your child after you provide the statement and gently guide them and then praise them and provide lots of encouragement for them going and following your statement or what you just said. Okay, so the final area we're going to focus on today is talking, or what we might call expressive language or vocal behavior. Talking starts early in development, well before the use of words. And we see that with babies making pleasurable sounds, babies cooing, babies making sounds of distress when they're hungry or need to be changed or held. And these sounds vary so that the caregivers learn to respond to them accordingly. And so eventually after that, we have the babbling and then the words and short phrases and sentences. And that's kind of, a traditional way that that talking might progress. So how can we encourage this? The first way is similar to what we just talked about for encouraging receptive language, is to talk to your child often. Label what you're doing and what your child is doing, labeling things around you and your daily activities, reading to your child. One really important way is to imitate your child's sounds. Now, we saw that in the example of social turn taking and back and forth, but also imitating what they're saying. And then expand on what they say. So if they use a sound or a word, Maybe they say baba for bottle, and you say, yes, that's your bottle. It's yummy. So repeating what they say and then expanding and adding something else. And again, a similar strategy here. You're going to give your child the opportunity to respond. So you don't want to just be talking all day long, right? So you want to maybe say something a few times and then pause, right? So again, that same strategy of repeating things over and over and pausing and waiting. This is our final video of mom and baby sitting on the floor. They just have some toys out, and mom is just labeling what baby's doing, right? She's giving labels for the toys. She's providing labels for what baby's doing. And you can imagine how you might, use this with toddlers and preschoolers, right? Here, of course, these are examples with a young baby or infants.
You want to play with your fishbowl? Oh. Well, what are you going to do? You took out a blowfish. Wow. So cool. Look, Hannah. A orange fish. Got you. You like that? There's the orange fish.
Great example of talking while playing with your baby.
You want to play with your
I have some final tips I just want to highlight. So, you can work these activities into your daily routines. You don't have to stress about it or say, oh, I have to find time to sit and do that. Just really make it work in your everyday schedules. You can do this during playing or eating or bathing, getting dressed, grocery shopping, driving in the car, whatever it is, whatever fits into your time with your child. You can make those moments meaningful. So really think of it that way. Having these meaningful moments versus, oh, I have to sit and do a long, teaching session with my child, really working it across their daily routines will be most impactful. I did mention this already, but during play and just kind of having fun and being silly about it, I think as parents, sometimes we might get stressed or overwhelmed if we're taking this on, right? And we know that, we're the ones that can really push the needle in our time with our child at home and everyday routines, but really try to just keep light about it. If you're having fun doing it and being silly, your child really will be more motivated to interact with you. Just some final advice is, don't wait. Don't hesitate. Timely diagnosis is important for early intervention and improved outcomes. So while you might be doing these things with your child while you're waiting, if, for services or an evaluation, if you have yet to schedule something or to reach out and share your concerns, please don't wait. Please, get in touch with a professional as soon as possible and get started on getting that intervention and evaluation going. Anyone, a variety of professionals can do evaluations. So licensed psychologists can evaluate children for autism and developmental delays. Of course, medical doctors, pediatric neurologists, and developmental pediatricians, but also speech and language pathologists. You can reach out to your state early intervention program. They offer services. Also, it's good to be informed about your insurance options early on, before the child turns 3, before they're school age, and become the responsibility of a school district. It's really, early intervention and/or your insurance, right? And so know what if you have private insurance, know what your benefits are. If you're in a government program, know what your benefits are. And if you don't know, it's, reach out and get that information so that you will not have any obstacles or barriers to getting your child evaluated or the services that they need. These are just a few references, and I know these slides will be available. Spark will make them available to you. So if you're interested in kind of, digging down deep into the research literature here, here are some resources there. And I really just want to end by talking about Alpine Learning Group and our services that we offer. We are located in New Jersey, as was indicated in the introduction. And we're here from diagnosis to intervention. We can help. We do have some telehealth services that can be available as well. So please reach out to us. I have our phone number here, and this QR code that you can go to and browse our website. There's also additional free resources there for parents. We have a video library. So when you're not checking out Spark's videos and webinars, you can come to Alpine's website as well. And the more resources, the better. And that's all I have for today.
Great. Thank you so much, Dr. DeQuinzio. I think this was, hopefully provided parents with some really nice, tangible tasks that they can work on with their kids. So
Great.
we have about 15 minutes for questions. So let's, jump right into it. So you mentioned, right at the end here, talking about the importance of early diagnosis, early intervention, and throughout the presentation, we saw, I think her name was Hannah, the infant in some of the videos, and then more of like a toddler. So just from the scope of the presentation and that emphasis on early diagnosis, is there a point in time where you've seen that kids have sort of aged out of these foundational activities being really effective, and how can parents know if maybe their kid's a little bit too old perhaps?
Yeah, that's a great question. This talk was really geared towards early childhood, right? Infant, toddler, preschool. However, the strategies that are used here with repeating activities, using language, modeling language, can really be used at any age to promote, the social skills and the language skills that I talked about here, and using gestures. So for example, you could have a child who's older, right? Maybe 7 or 8, and they don't have vocal verbal behavior. Maybe gestural communication is their main way of communicating. You can still set up those kinds of opportunities for them to, come to you to help them open something, or use the opportunity where they can't reach something or get to something, to teach them to point to it, to gesture toward it, to look back at their caregiver. That teaching strategy is known as, more formally as incidental teaching. Some people also refer to it as pivotal response training, a little bit different presentation, but all similar. It's really about using the child's motivation as a teaching opportunity, whether that's to teach communication or some verbal behavior, or to actually teach them to engage in the task themselves. So maybe you're looking to teach some independent skills. You might set up those scenarios where things, aren't working, or they can't do it, but then they have to problem solve. And after they engage in a little problem solving and an independent work, then you might come over, and help them. So it really does depend on the child and what the goals are for that child. But these strategies are generalizable across all ages and skill domains. I hope that answered the question.
Yeah, I think so. And if people would, like to dig deeper on that, please utilize the Q&A, and we can hopefully, dig deeper as needed. Moving on to a different question though. So again, looking at the videos you showed, which thank you for sharing those. I think that really helps people sort of wrap their heads around some of these tasks and what they look like. But specifically, I want to talk about the mom with her infant. Something I notice, and I think other people notice too, is that the mom is very upbeat. She's a very bubbly persona when working with her child. Have you observed that approach and that tone of voice and that energy has different outcomes, and maybe different approaches that parents might take?
Yeah, a lot of this is individualized, right? So if your baby might be sensitive to sounds, moms know their children the best, right? And so if a mom might not be as loud or as enthusiastic if they notice that maybe their baby might or young child might wince, right? And so really just kind of being in tune to that and really creating, the activity and around what your child likes. So maybe it's swinging on a swing, right? And the child is swinging and you're pushing them. Maybe you're singing a song. Maybe they like a quiet song. Maybe they like a loud song. Whatever it is that they like, the main technique of doing it repetitively, something they enjoy, right? Something that they want to continue to happen so that when you pause it, there we have that motivation to look or to say something or to point or to gesture, whatever the response is that you're looking for. So really, individualizing it and to what your child is interested in and is comfortable with. Also, just kind of on that same note is that if it's hard to get your child's attention, it might be making that the social interaction more salient, right? By speaking a little bit louder or being more animated. That might help your child orient towards you or be interested and look in your direction. So it's really kind of just about playing around with it and seeing, what works. Trial and error. And there are no wrong mistakes, only, opportunities to learn what to do again or not do again next time.
Great. And then, again, I guess this kind of goes back to this being sort of situational. Everyone's situation and working with their own child is going to be a little bit different. But are there
Right.
any, you mentioned throughout with all the different activities, if not all, definitely most of them that, as you're working through these activities at a certain point, you should maybe increase that wait time between your initial prompt of a behavior and your child's response. Are there any sort of like key indicators for parents of like, okay, my child's did X, so maybe I can increase that time between responses?
Yeah, definitely. Great question. Really just being a good observer of how they're responding. And maybe at first, they might not do the whole response. Maybe they'll just do the response partially. So for example, if you're looking to get them to, look in your direction or make eye contact, perhaps maybe at first they might just turn towards you, right? And still not be looking, but maybe you accept that, right? Because before they were turned away completely, right? And then maybe on that next trial, you wait a little bit longer and maybe their head moves up towards your face, right? And then eventually maybe you get, even just some fleeting eye contact, which is completely fine, right? We don't need or require, kids to stare at our eyes for long periods of time. That's not what we're looking for or expecting or even, developmentally appropriate. So that's called shaping. And that's a strategy where you might, as a parent, say, all right, you know what, this is a lot to ask all at once. Maybe I'll just start by, reinforcing or rewarding a small component of what I'm looking for. And that really, gives parents the opportunity and the child the opportunity, to continue with the pleasurable activity and not create frustration, which could happen. I think I answered your question, but then I may have opened up another avenue by adding another strategy there. But I think that was a good opportunity to talk about shaping.
Yeah, definitely. And I mean, not to put you on the spot, but if there's anything you wanted to add about shaping that you might feel is useful to this community, we can
Absolutely.
definitely go
It's just
there.
another, it's another strategy, just kind of reinforcing or rewarding just the maybe smaller components of the bigger response you're looking for. A great way to start with some things that might be too hard at first.
Actually, a great question just came in. It's an interesting thought here. So obviously these are geared toward parents, things that people can do as part of their
parents, caregivers, grandparents, whoever, right?
Yeah, right. As part of like a daily routine, whoever the caregiver may be. But as the kids get a little bit older and maybe are entering school, should schools be involved in this in terms of following a parent's learning systems, and is there a way for parents to maybe make that so?
Yeah, I mean, I think that anytime that a child has an intervention team that includes parents and caregivers, that everyone should be, kind of open to talking about what has worked, right? So if your child has been home with you and you've been, had some success with these strategies, and then maybe, you have an intervention team at home, and then, it's time for them to go to school. We always absolutely encourage teams and families to work together and share what the successes are, right? So if parents are finding that this is there's a certain way that helps promote looking or, using language, and I absolutely encourage them to share that with any of their providers and educators. Hope that
Great.
answered that
Yeah,
question.
great. Thank you. G- Going back a little bit to some of the, the foundational activities you shared, one of which you talked about, singing songs and using some of those
Mhm.
books. You specifically mentioned Brown Bear as a helpful
Mhm.
a book that you recommend. Are there any other
It
books
was
you might?
really an example.
Yeah, right.
Yeah.
As an example, sorry. Are there any other examples though that you might for parents that are maybe looking for those kind of books, or do you know of a place that you could point them, like a internet resource or something where they can find
Yeah,
those books?
I don't have any specific place, but anything repetitive, I point that book out, and there are many examples of books like that. I think that's just one where, and they're done that way on purpose, right? Because the people that write those books have some understanding of child development, right? So just kind of repeating the same thing over and over and only varying one piece of it, right? So brown bear, what do you see? I see a, and then there's a picture of an animal. That gives the child maybe the opportunity to maybe say the name of the animal or point to the animal, right? And then the next page, it's the same sequence all over again, but a different animal, right? So anything that is repetitive, um, that the child gives the child the opportunity to experience that more than once, right? And so then they can learn and have more opportunities to learn whatever it is that you're trying to teach, right? Whether it's a point, a vocalization, looking at you. Again, the theme here is to repeat, pause, repeat.
Um,
So really, going online and Googling, is always a good thing in terms of finding books and activities for your young children that kind of fit into these themes. I wouldn't say going on and Googling is good for other things though.
Books seem like
Talk,
a safe.
yeah, but books and toys are safe. And then, Googling professionals that you can talk with and consult with is good for everything else.
I think that was a very useful clarifying point. Yeah. Um,
We all know that. We all fall into those traps, right?
oh yeah, I think we're all probably guilty of that for one time or another.
Hmm.
Um, and then, sorry, I just lost track. I have a list of questions here, which is great, but I lost
Great. I
track of
love this.
my
This is
my next
excellent.
one here. Oh, here we go. I have it highlighted. So again, we talked about that these are really for caregivers, whoever that may be. Is
Mhm.
there at a certain point where you've noticed that maybe too many different people in the home
Mhm.
or in the child's life are working on these interventions? Like, is there, or is that maybe situational? Um,
I think it's just, yeah, it just depends on the family. I think for some, and the child, of course, maybe for some children, just having, a very limited at first way, maybe when they're first learning, having maybe only, a couple, two or three caregivers, and then, broadening out, you want it when a child's first learning something, and in the case of autism specifically, where you want the child to have as many opportunities as possible to experience the learning opportunity, you might, and you want things to be consistent, right? You don't want a variety of different, too many versions, right? Because too many versions of something might um, some point is good, but then it might too much might be confusing, right, for the child. So you definitely want consistency. Consistency is important. And variety is important to a point. If the child isn't learning, then it might be the case that, there's too many different things happening, right? And so, only having certain people work on it could be helpful if that's a problem. If it's not, and the more people that can get in on this and use these strategies with the child across the day, the better.
It sounds like some communication is probably key amongst those who are working with child, whether it's just parents, grandparents, or when they get older and going back to that school question and working with your care teams. So great.
Yeah, I mean, I want this workshop and webinar is really just about practical things that parents can do every day. And so, I wouldn't think of it as working with your child. I would think of it as, I do another talk called The Power of Play. And it really is, it's very similar to this. And it's like, wow, how can we make these everyday activities, one being play, the others, which we talked about today, just how can we make them learning opportunities? That's really what this is about. And to kind of have that mind frame and of this is like something I can work into what I'm already doing to help just promote my child's social and communication skills. That's really the theme